Hello and welcome to Note to File, a clinical research podcast.
A collection of interviews, candid commentary, and general nonsense for the clinical research community.
Check us out at notetofilepodcast.com.
And now, without further ado, on to the
show. All right, guys. Hello. Welcome to another Note to File. It's first of 2026. How's it going, Denali?
Good. 26, man, it's the first time. It's January 8th today, and excited to be back this year. I know we have a lot to organize this year, but excited to kick it off.
Yeah, I think I'll see if I remember how to do this.
Good luck.
Let's go and welcome our guest, Dr. Les Enterline. Thanks for coming on today, Doctor.
So, I'm not a medical doctor. I'm a physician assistant by training, but thank you and appreciate being here this morning.
Yeah, absolutely. Let's cut right to it, man. Open it up like we do with most of our interviews. Just tell us a bit about your background. I know you've been in the industry for a while, but it's kind of fun to hear, people's journeys and how they got where they are. So let's hear your origin story.
Yeah. So as I said, I'm a physician assistant by training. Medical and surgical hematology, oncology are my specialty. At this point in my career, I've worked across all major therapeutic areas and done that both as a clinician and in research. I got into research because I was looking in a community practice where I was running a research program and looking to be able to bring new innovative therapies to oncology and hematology patients, and more importantly, to give them access in a community-based setting. So we partnered with academic institutions. So I was very involved in academic research before joining industry. I initially joined industry to kind of get the inside scoop on how do they approach choosing sites, what makes the decision on what studies they're going to move forward with, how do they develop budgets, that kind of thing. I actually thought it would be kind of a two or 3 year stint, and then I would jump back. I was fortunate. I was at Bristol Myers Squibb for 18 years in varying roles of different levels of responsibility, all involved in research. But they also allowed me to continue to see patients. So that allowed me to have kind of that touch with patients so I kind of had best of both worlds, but left BMS and moved over to PPD Thermo Fisher, and have kind of stayed because what I found when I entered into the industry in Bristol, that one of my primary goals was to get innovative therapies to patients quicker. I actually found that I was in position to influence and impact that in a greater way on the industry side, and connecting with our investigator and site partners, kind of understanding both sides of the fence, so to speak. So that was I've clearly ended up staying entrenched more on this side of the spectrum.
Yeah, I know. I don't know. I always like that. That's so. I mean, sounds like you essentially started on the site side.
Yes.
So from site to sponsor to CRO. So, not terribly common to see somebody who's able to have that sort of rounded out experience. I find it fascinating. I mean, I've worked at only the site like my whole career, and a lot of those dynamics between sponsors and CROs are like really not clear or not very transparent. And I know one of the things like mainly we want to try to talk about a little bit today is sort of the CRO models in terms of their relationships with sponsors. And I'll admit again, from the site side, I have no idea. Sometimes we see someone who's got a email address that says the name of the CRO. Sometimes it says the sponsor. Sometimes it says the CRO working on behalf of the sponsor, or it gets very sort of unclear, like how this all works. So I guess, can you explain it like I'm 5? in terms of like how do like traditionally CROs and sponsors model, like or how do they work together?
Yeah, so I think when you're seeing the email addresses different, it's what we would refer to as more the functional service partnership, and that's what I'm currently leading at Thermo Fisher. But I've worked in the CRO, I've worked on the full service side and led teams, global teams in that space. And I think I'm fortunate that I have the site experience, but I also have been benched all the way through lifecycle management of a product and really understand the importance of not only that first indication, but how do we broaden the indications of products and the importance of that research and actually the importance of real world evidence generation. But when to your specific question, there's kind of two tried and true models, right? The full service outsourcing model and the functional service partnership model. On the full service outsourcing model, the sponsor or the client is coming to the CRO and basically saying, we have a book of work that we're going to manage internally, and we're going to use our internal resources, and those internal resources may be augmented with FSP resources to support that research. But our pipeline is robust, and we have a book of work that we need you to fully manage, right? And so that's the full service. They're basically saying, here's the protocol.
They're handing it all over. Here you go.
Here's the drug. Here's the protocol.
Go, right? Sometimes it's fully baked. Sometimes here's a synopsis. We need you to develop the protocol in conjunction with us, and then you're going to go, right?
Even fuller service.
Even fuller service, and you know, I would say we work across the spectrum, and that's great. And I think both models are important to meeting the needs of bringing new therapies to patients quicker, and also ensuring that our sponsors are able to make appropriate priority decisions related to their portfolio and investments, right? All of us that are in research, we recognize the precious commodity that a subject is, and we want to make sure that we're putting them onto and enrolling them into studies that are actually going to advance science. And both models allow that to happen. And I think we work pretty seamlessly in both models.
So I've never sat on the sponsor side of things before. If I'm a sponsor, what's going to lean me towards the full service model versus the FSP model? Like what's going to guide me just to pick which direction I'm going?
So, excuse me, I think sometimes sponsors choose to lean in a full service model because they're breaking into a new indication and maybe they don't have the depth of experience across their research talent to actually run the study. They may have the senior people that understand that indication, the nuances associated with that product and that patient population, and they'll definitely be involved. Sponsors provide oversight. It's not like they're checking completely out of the situation. We're really, even in a full service model, we're an extension. In an FSP model, there can be situations where they're running the study in-house, but because of the timeline of different deliverables, they may need some staff augmentation. They may need special services brought in to support by their biostatisticians or their medical writing, or in some cases, CRAs, right? When sponsors look to move to outsourcing their ClinOps or certain functions, it also helps them better manage the ebbs and flows of the pipeline, right? Instead of being, we're ramping up because our pipeline's really robust, but then these couple studies don't indicate out as quickly as we thought they were, then you're sitting with a lot of overhead expense of really talented people and if you're talented and experienced, then you're not cheap, right? And not to mention it causes organizational disruption where if they're partnering in an FSP with us, then we're able to manage that ebb and flow and help them with that resourcing and forward looking and recognize that if they're bringing in something sooner or they had a really positive outcome and they need to ramp more quickly, then we're able to ramp more quickly just based on that's what our model is and that's what our service offering is.
Yeah. So, and maybe I guess for probably both of you, but also Brad, question, like, would you be able to tell what model is being used to support the trials you're running from the site side?
Yeah, I mean, I don't know. Honestly, aside from maybe, again, sometimes if I notice in an email that a signature is like mentions it, and occasionally I've seen more and more of that. And I guess, and I would ask you too, Les, like, do you think there's a different impact on sites based on the model? Like one thing that jumps out to me, and it may or may not be relevant at all, but CRE turnover is challenging at sites. Do you think, does one model tend to better address that or preserve that in one way, or is not so much? Do you not really have much impact?
I can't speak for other CRO providers. What I can speak for is that we have very little turnover. In fact, my teams in FSP, when they're embedded with the client and they're working with the client, so they're really representing the client, right? We have 95% retention rate in those partnerships. So what I would tell you, and this was true when I was on the sponsor side, the success for me of an FSP relationship is that the site can't tell the difference. When I walk in the door, I'm representing whatever sponsor I'm working with and I'm providing the service for at that time. That's a win-win. So I always tell my teams, when I get compliments, whether it's internal or external stakeholders, if they can't differentiate who that employee is, carrying a badge for, that's a huge success. That's a great yardstick for me, and I think that becomes really important for our sponsors, right? That gives the low turnover rate. I was on a site. I know the value of the CRA being the same CRA and kind of knowing where the bathroom is from a simple perspective,
Sure.
Right? And not interrupting you through your day-to-day. Like they need to do their job. You've got other stuff going on. You're making yourself available, but you can't. You want you and your staff to be comfortable with the person that's come in and is sitting in your office. So, but I think the goal is that you really couldn't tell the difference.
Yeah, and again, I would say that's probably true, and maybe because I've become more aware of that being an option, I've tried to pay a little bit more attention. But yeah, I mean, over the last 15 years, it's only been probably within the last year or two that I've really kind of started to pick up on it occasionally here and there. And sometimes it's literally me just asking, like, "Hey, what's your deal? Who do you work for? What's going on?" And again, not that it really matters, but do you think has there been an increased interest in the FSP model recently? And if so, like what's driving that?
So there's definitely more interest, both on the biotech and the biopharma side. And I think it's multifactorial. It's everyone looking to meet the primary goal, get new therapies to patients quicker, and the fact that it's not a blank check. It's expensive to do research, and so how can we do this efficiently? And let's just be honest. If you're able to use with confidence that you're going to have the same quality and excellence, a group that has a larger pool of trained individuals that can manage your ebb and flow, that takes a lot of strain off of your internal team. and lets them focus. They're not focusing on training people. They're not focusing on interviewing and worst case exiting folks out of the organization. It allows for that flexibility. What I think a lot of people are hearing is there's a move to a more hybrid approach, or I like to refer to it as a mixed model, because that's what it really is. So the sponsor may be looking to, independent of whether they're running the study in-house or they're using CRO partners in a full service model, they may want to have consistency as if it was their internal team, let's say around medical writing or bios, and they'll have us work in a mixed model in that we could be providing those services, but another CRO could be actually running the study, right? So the CRO that's running the study is working with us because we're the contracted service for medical writing. Or the flip is that for all in-house studies, they're no longer going to have a large pool of CRAs, and they're going to use CRO FSP providers to provide that FSP service, which helps them deal with, hey, all of a sudden we enrolled this study much quicker than we thought we were going to enroll it. We need to now push up the database lock, and so we need to get this data cleaned quicker and monitor the study. So for me, it's around that flexibility and the agility that the teams are able to move with, but also they know what that fixed cost is going into the work.
Yeah, okay, that makes sense. And I guess I've seen, again, from the site side, seeing like 2 CROs working on a project sometimes. So that may explain them essentially they're using a hybrid or mixed model, which again, to me, I'm like, this just seems insane to me, because that seems like a lot of coordination, like between these different groups, which also like kind of makes me wonder too, like in an FSP model, is there any like potential for friction between, I mean, and again, these are assumptions on my part, so please correct me, but I assume in an FSP model, the CRO is going to be following sponsor SOPs maybe versus the CRO's SOPs, and if those ever conflict, like I guess how does that play in, or does it really? I assume it does to some degree.
Yeah, well, typically if somebody is fully allocated to that sponsor and they're working in an FSP model, it's not like they're following our company SOPs and process. They're embedded in that client, they're following the client's SOPs and process. So they followed that recipe card, so to speak. So it doesn't really create any conflict. And in a mixed model, if there's a particular service, the reason that they're doing that is to provide that continuity across their entire research platform. So,
Sure.
So it's interesting. So you mentioned, like, and I think we talked about this at a couple different podcasts over the period of time, like the relationship between sponsors and CROs and sites. And sometimes it feels like that Spider-Man meme where like everyone's kind of pointing at each other. And there is sort of there seems to be an inherent friction between sort of those 3 entities. Do you think any of these models change that dynamic? And I guess, especially given your background and experience, you've worked at all 3. Like, what's your perspective on that sort of dynamic? Because I think we've had conversations where we're talking to a sponsor and they're like, oh, it's the CRO's fault. And the site's like, it's the sponsor's. Like, everyone's kind of just like pointing at each other. So like, how do these models play into that? And do you see one helping the other? And just what's your perspective on that general landscape, given your experience across all 3?
So I like to work in partnership relationships. And so I try to avoid the finger pointing and recognize that we're all doing clinical research. And that means we're working with human beings, and it means that there will be hiccups, right? We're going to hit speed bumps. And the best resolution is when we come together and avoid the finger pointing, right? I get that it happens, and I think often sites think, oh, it's much better if we're just working directly with the sponsor. And that could be today's message, but tomorrow we could get the same message that, working with this CRO or with this partner, it's very seamless. I think some of that comes down to the people that you're engaging with.
I was going to say,
Right.
I'm with you. It can go either direction depending
Right.
on.
It can be sour on both sides of the fence.
Sure.
I think in the FSP space, if we've done it right from the site perspective, they're going to feel like they're working with a sponsor. That they absolutely should not think, oh, that person they're really a Thermo Fisher employee, or they're really an XYZ employee. They're representing the service that they're providing, is representing that client. And that's why it's really important that they're following client SOPs process. Yeah. What are the objectives for this client? They may have a different primary objective related to how things are conducted at a site and how you work with that site over a different sponsor. And so I often say, to be successful in FSP, an individual has to have a bit of an entrepreneur mindset. Yeah. And that self-starter, right? Because you're kind of dropped in, and you can't be saying, well, we do it differently over here. It's kind of like starting a new job and saying, well, when I was at blah, 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 this is how we did it. Well, guess what? I don't know if you read the door when you walked in, or right. or your computer screen, but you're no longer at, blah, blah, blah. So I think the important thing is sites are a huge partner, and we all have to recognize that they're partners. And in some modality, or therapeutic areas, those sites are also day-to-day clinicians. And research is a component of what they do. Some are only do research. Sure. But certain indications, they are doing research, like oncology. We had a full day of patients that weren't on clinical trials, right? So I think when you walk in the door, you have to understand that and respect that stuff comes up. And what I always tell my team is, you've got to understand the environment you're walking into. You have to understand that individual investigator's practice and what their situation is, because you may have been at Dr. Jones' office 3 days ago, and Dr. Jones in that office may only do research, but Dr. Smith in the office you're in today, 50% of his or her practice may be research, and 50% may be taking care of patients. And guess what? One of those patients could have walked in the door with an emergency, and you just needed to take a breath and recognize that you could be that patient, and you would need Dr. Smith to step in and take care of you in your emergency.
No, I think that's amazing advice that I don't see. It's a mixed bag. I don't see maybe being given enough attention. Even like, sounds like not unlike what you were doing. I work with a lot of community practices. These are practicing clinicians, independent, private practices. We also work with a hospital system, which you can imagine have different priorities or different ways of operating. Work with a retired physician who just does research. So even one company is working with various, sort of layouts and how like these physicians may work and the practices may work. And I think on the flip side of that, even like conversations like this, I think it's interesting and maybe useful for sites to know, like, this is FSP, or this company is doing this function for this reason, while versus it being a full service model. I think that'd be useful sometimes for sites to know. I understand your point about it sort of like being white labeled, where I don't know who you work. It looks like you work for the sponsor. I don't know any different. And maybe that doesn't matter. but I think maybe it could too. It could help provide a little bit of context sometimes into how these relationships work, so that, sometimes if I think I'm talking to the sponsor and I'm not, that may be just useful to know.
Right. But if we're working for the sponsor, you are talking to the sponsor.
Fair.
Right. And it should be very clear if it's a full service and we're the CRO. But I think early on in my career, probably, one day that sticks in my head that, and I had CRAs on site monitoring, and I had three different subjects getting on 3 different trials, and I had 3 anaphylaxis happening simultaneously, and I was the only clinician in the practice. And somebody was like, as I'm running from room to room doing stuff, I had a monitor chasing after me about, we were back with sticky tabs.
Fix a query, yeah.
So I understand that they have a job, but I think it's really important. An important thing for us to do is help people that are stepping into those roles understand kind of what is the day-to-day of this practice? How does it run? I always ask those kind of questions, like, what does this investigator do? Are they only doing research on Tuesdays and Thursdays? Kind of situation.
Yeah.
I probably don't want to monitor on Wednesday. Right.
Yeah, ideally so. And again, I think that's getting a little bit better in terms of, I think, to your point earlier about it being more partnership based versus these just kind of quick transactional ordeals. Like, yeah, we're here to monitor, whatever. We don't care. And people are showing a little bit more interest and investing more in learning how a site works. And there's some, I don't know, BMS isn't or isn't, but I know some of these sponsors do a much more sort of like due diligence on the front end to come to your site, actually learn about your site, not just ship you an FQ and be like, oh, good, maybe we'll select you and maybe we won't. Here, let's talk about what does your practice look like? What does your day-to-day look like? I think that's amazing. I mean, I think that can help, allay a lot of the issues that we currently do see.
And I think we're trying to institute, in partnership with our clients or the sponsor, how do we use technologies? How do we also recognize that we may already have some of the information? So let's be less burdensome to the sites, because what the sponsors are realizing, with the crunches of cost associated with research, it's the sites are realizing the same thing. And then the ability to find staff and retain staff is a challenge across the industry, right?
Yeah, it sure is. It sure is. That's definitely an understatement, it feels like. So hopefully we see some stabilization there.
Yeah.
So is it fair to say, like, historically FSP maybe has been, big sponsors or big pharma has used FSP a little bit more, maybe because they want a little bit more control over what's going on? Are we seeing smaller biotech, smaller mid-sized biotech like Institute or sort of use FSP more? Definitely not having a stroke. Bear with me.
Yeah, I would say biopharma by and large has been the largest use of FSP. What I would say is that their models are shifting. So they typically were more an FTE based only model. We offer kind of FTE, unitized, partial FTE, trying to flex, again, showing that agility, especially as they're breaking into new indications or breaking into new countries. They may not have the volume of research to support. And so we want to make sure we're supporting them from a financial perspective. I've always advocated that biotech should lean in more, and I have seen them leaning in more to an FSP model because typically they're smaller by structure anyways. And so their FSP can bring a lot of that talent and knowledge to the table for them and grow as their portfolio grows. So, you know, probably what I see more in biotechs is that it's a different level of FSP talent that they're looking for, versus biopharma is going to have more of that senior level talent, and they need more of the troops, boots on the ground to expand their footprint. There is a push, especially, you know, as regulations change, in you know, I think it's E6R4, whatever. The agencies, health authorities want sponsors to be actively engaged. I've never seen where sponsors haven't been actively engaged and oversight, independent of whether it's FSO or FSP.
Sure.
But in both models, you know, I think important thing for sites to know is that it doesn't matter which model's being deployed, the sponsor is very involved. They have oversight, and it's not like hands off, you know, we're just sending you a report. They're checking in, they're reviewing. It's an expectation by the health authorities, but they were all doing it, right? It's part of their goal. It's their asset. So
presumably they're investing a lot of money in this, so that's not just being like, leave it off. Let's leave it to chance. Good luck.
Well, and I think when I was in a site and I was working with a CRO, I didn't appreciate how much a sponsor was engaged and involved. Right? I always thought, okay, this is the CRO is running the sponsor. But as I've been on my journey of my career development, everyone's very involved, and there's lots of communication. And I would say it's only increased. And the technologies and the advances that we've had have allowed it to be more streamlined and allowed more real day-to-day access. So in the old days, you know, you were waiting for that report to be generated, but many of the systems that we utilize, the sponsor has day-to-day access to those systems, which I think will only enhance the quality and ultimately drive the speed of delivery, because you're not going to have delays in decisions if a decision needs to be made because they're waiting for a data output.
Yeah, and I can definitely sort of echo, as a site, sometimes you're like, I have no idea if the sponsor knows what's going on or not. And again, it's a silly assumption, but I think sometimes it can be hard to know when you're sort of, all you deal with maybe is a CRA, you know? So you have no idea what's going on at a higher level. And I want to kind of touch on something you, in a roundabout way, maybe got to, but what impact, if any, like does AI have on an FSP model, where if things like data review and monitoring can become a little bit more automated in time, like does that shrink what FSP does? Does it sort of just change the dynamic a little bit, or is that not really something we're seeing in at least the immediate future?
So we definitely can see where efficiencies come in with AI, but because we're following clients' SOPs and process, some of it is related to how quickly, like PPD may be really far ahead with when we're working in a fully outsourced model and we're working in our systems and processes and how we're engaging AI. A client may not quite be there with their systems and processes or their adoption. What we do, though, because we're in a partnership, is we bring that information to the clients. And I think across the board where you're going to see huge gains is administrative task, right?
Sure.
Those day-to-day things that simply take time. If we can engage an AI agent, then and then deploy it across a workforce, then you're going to absolutely see those efficiencies. what we know is that by using AI as programs grow, where you traditionally were having to just add numbers to meet those programs, the efficiencies will be recognized not in the first program, but likely in subsequent programs, because you're able to say, well, we needed 5 people to start this, and if we were doing it in a traditional model, we would be adding another 5, but actually we only need to add 1, because we're here, and here's the reason why. This is what we were able to bring to you. I think there are certain areas that absolutely in FSP models or FSO models, you're going to see it. Medical writing, you're going to see it in data management. You're going to see it in how quickly you're able to get different consent forms translated, and it doesn't mean a human's not involved, but a human is not doing every single one of those steps along the process. So I would say some of it in FSP is dependent on the client and where their timeline is and their adoption. But what we are charged to do in a partnership relationship is to bring those efficiencies to the table. And even if we're doing something in FSO that we think is going to benefit them, then we try to bring that forward to our partners.
That makes sense. Would you say, is FSP sort of the go-to rescue model? I mean, it seems like something that would lend itself to that. Is that something you see it sort of utilized, or is it generally from the jump?
I think it's from the jump. It's a model. It certainly can be brought in to augment. So like the example I gave where you've enrolled really quickly, maybe you have your core team, but you need a SWAT team to come in to just augment them. FSP is a quick way to supplement that. I think when you're looking at cost efficiencies and ways to capitalize on really skilled talent, you could have when you move to a long-term follow-up, keeping that really experienced talent on a long-term follow-up study, if you can actually shift away and have more of a SWAT team approach and manage that from an FSP, we've shown considerable savings for our sponsors in just the day-to-day. That results in a positive for everyone. Right. We're able to execute newer studies, which means that the sites are getting more projects sooner, and then patients are getting greater access to newer therapies. So I think looking at those things, so that from a rescue, I think just in a general statement around rescues, there's a lot of complexity typically with rescues. Yep. So you got to kind of unpack why it's being rescued.
Sure.
And what's the tick box for that rescue is what I would say. So I'm not saying FSP isn't utilized in that capacity, but it depends on what what's driving the need for the rescue.
Yeah. So you mentioned like impacts that AI is having, but what do you think the future is of SFP models? Because I think we see kind of the pendulum swing between what models more in favor. Where do you see this going in the next 5 to 10 years? Do you see that fluctuating at all?
Well, the pendulum's always swinging in research. So I think that both models will continue to be used. I think different sponsors will, based on their culture and their ways of working, might be leaning more to one model at a particular point in time versus another sponsor. But I do believe that neither model's going away, in my opinion. And I think the mixed model approach is probably going to net out to be you know, where the sponsor finds that they've got some greater wins, so to speak. I think when you think about sites, for me, having been at the site level and knowing what's there, it shouldn't matter to the site. That's what we all have to make sure. It absolutely shouldn't matter. It should be, how do we help the site do what they need to do, and we take complexity out of the system, right? We follow the regulations, we do all that, but really, let's figure out a way that we're cutting to the chase. We're not starting with you know, we already have 3 studies open with you, and oh, we changed sponsors, and so now we're going to send you a brand spanking new template on a contract. That's one of the first places I think you use AI. If you've worked with that site, you put in your standard template and you say, where are there changes, right? Tell me what's Dr. Jones' site, right? Create an agent for Dr. Jones and his contract, because guess what? If you've got 3 studies open and all of those contracts have the same terms, study number 4 ain't going to change.
Right.
Because you change sponsors, right?
You just get there quicker.
Yeah, you get there quicker and with a lot less angst from the site, right? And especially working in kind of where you are, if you've got community and academic sites, typically if you send you know, an off-the-shelf contract to one of those sites that's worked with you, you aren't getting senior legal counsel review.
Right.
You're getting you know, you're getting somebody, okay, you take a look at it first and then I'll look at it, which is understandable, but it does delay the process.
Sure. Yeah, no, you're not wrong. And to your point, like as a site, I don't care what model is being instituted, as long as it's as seamless as it can be. Right. Which, you know, unfortunately is not always the case, but you know, I guess that's the ideal, is to make it. I mean, just as the way we work with a private practice, they don't know that like I'm maybe a separate company versus working for the doctor. And ideally, it shouldn't matter, because it all integrates and is fitted together in a way that it's not obvious that there are conflicts or anything like that. So yeah, I'm with you. Ideally. Again, no one's perfect.
And you know, actually, sites could look to us for provision of services too. You know, where we provide study coordinators and data management, and you know, sites kind of work in an FSP model as they have ebbs and flows if they're bringing, you know, talent in to augment. But so it's some of that is like, how do I bring this back to how you all work and help you understand it's just an extension of your business. It's just different roles.
Yeah, no, I think that's great too. Like it just that, again, I think a lot of the issues that exist that, you know, Denali's pointing back to earlier, that conflicts arise, I think is really just a lack of understanding of each of the, you know, players. And if we just talk about it like this, you're like, oh, okay, well, that makes sense because I do this, which is similar to what you're doing. Yeah. And at that point, look, doesn't necessarily mean everything's going to work perfectly, but then you at least gain a different level of understanding and even empathy for it, to be like, okay, now I understand why maybe this particular issue keeps arising, but I know, and now we can work through it. And I'm not like, what the hell is going on?
Yeah.
I think people so often end up being like in their little bubble and like, this is what's right in front of my face. And this is a challenge I have. And it's because of you, whoever the you is, right? And then but it's a lot easier. Like, I mean, it's exactly to that point. Like, even if it doesn't change a damn thing, if I understand like, hey, you're using the system and it requires you to do A, B, and C, and B is probably repetitive, but it's just kind of the way it is. And you're asking me for A, B, and C. Now, at least I know. And we're on the same page and we're in it together, as opposed to being adversarial about it.
Yeah, no, I tell people, don't get defensive if somebody's asking a question. You need to hold the mirror to your face because you didn't explain the why And so they're having to seek out the why.
Yeah.
You know, and to your point, I think if you tell people up front, look, we're working on this, but today the system is going to make you repeat the same information 3 times. We know it. We know it's a challenge. I apologize up front.
Yeah.
Right. It's like recognizing and appreciating, hey, I'm working on this. And as soon as I can get it taken out of there, we'll get it taken out of there. But if I wait to get it fixed, it means that we're going to delay this project starting X number of months. And that means you're not going to have this particular agent to offer to your community. So
yeah, you can't let perfection be the opposition of progress, right?
Yeah. And the beauty is there's less and less people that remember back to when we were notebooks and Post-its. So we've come a long way.
Yes, it has. I'm curious. I mean, this is kind of maybe a little bit of an aside, but like you worked in pharma for 18 years. Yeah. What was like the most, I don't know, interesting or shocking thing kind of moving over to the service provider, like CRO side? Was there anything that you found that was just like, oh, I didn't understand that until I came over here?
I wish I'd had a better appreciation of partnership. And I think the industry has come a long way in the, time, 12 years that I moved over. We have tried to really work on both sides of the fence to say more is going to be gained if we come to this together versus, you're a vendor and I'm the person signing the check, so to speak. That I would say over the course of time has been the biggest shift that I've seen. And I think it's been a huge positive shift. And I think has allowed us to move technologies, different products, through the research cycle quicker and really take some of the redundancies out of the system because we're working together. In they're recognizing that there's experience across the continuum,
yeah.
and there's a value in maybe listening on both sides. Is what I would say. But
yeah, I do think I'm at least hearing that sentiment more from the side. I think there's an effort to, even going back to the beginning of the, talk here, of understanding each other better so that we can partner better. Because I think that's, again, a lot of it is just, bad assumptions or, otherwise lack of understanding. And, if we can overcome some of that, I think that seems, it may not sound like a lot, but that goes a long way. It goes a long way towards working together better. Because again, to your point, also, we all want the same thing. We're all working towards the same goals here. And it's just, at the end of the day, it's just humans doing it. So, the more we understand each other, the more we can get past some of that stuff.
Yeah, and I think at least for me, my metrics show that, right? If we have 95% retention of talent in partnerships, and really our partners want to see the team, the individual advance and stay within that partnership. And sometimes when we're losing people, it's just that they've advanced their career to a point that we're no longer, they're moving to a service or a level that's no longer needed by the client.
Sure.
In that particular relationship. That to me demonstrates in an FSP space that we are working as partners and trying to drive towards the same goals and objectives, which is hugely important.
All right, very good. We're kind of down to the last couple of minutes here. Anything you want to wrap up with, or any sort of any final words as we get ready to sign off here?
I don't have any. I appreciate the time and the invitation to participate here, and I'm happy if if folks have questions, to chat with folks. And if tougher questions come up, I'm not afraid of questions, so you can send them my way. So
where can people find you?
So they can certainly find me on LinkedIn, that's probably the quickest and easiest. Not getting bogged down in the emails, but if it's something specific about a project or something, then of course they can contact me on my company email.
Yeah. Cool.
Yeah, we'll make sure that we publish your phone number out there for everybody.
Yeah. Appreciate that.
You can get some daily horoscopes.
There you go.
I'll make sure I give you the right phone number.
Well, very good. Yeah, thanks so much for coming on. Denali, you got anything?
No, I mean, we have a busy next couple of months. I think this is sort of for our industry of conference season. So I think we'll be in and out for the next couple of months, but it'll be exciting. I don't know nothing specific to add, but excited for kickoff the 26th.
Very good. All right, Bless. Thanks again. And
Thank you.
We'll see you guys next time.
Yeah, take care.
Thanks for listening to Note to File. We're committed to continuing to bring you independent and unfiltered coverage of the clinical trial industry.
We want to talk about what you want to hear. So if you have something on your mind, hit us up at notetofilepodcast.com.